the normal QT interval, that is 0.35 seconds. During the rapid ejection fraction, the ventricular pressure is A80, 120, 0, 15, 30, it doesn't change. During rapid ejection fraction, ventricular pressure is 80 to 120 millimeter of mercury. Which one of the following is an early phase of systole? Early phase of systole. This is isovolumetric systole. When the pressure in the ventricles become lower than the pressure in the atria, the pressure in the ventricles becomes lower than pressure in the atria. The ventricles contract, blood flow into pulmonary trunk, blood flows into the atrioventricular valves open. This is the answer. The AV valves open when atrial pressure is more than ventricles. A 60-year-old woman has a resting heart rate of 70 beats per minute, arterial pressure is 130/85, and stroke volume is 100. What is her cardiac output in milliliters per minute? So cardiac output is फॉर्मूला जो है इसका क्या है, स्ट्रोक वॉल्यूम इनटू हार्ट रेट. ठीक है, तो स्ट्रोक वॉल्यूम इज 100 एंड हार्ट रेट इज 70. सो द आंसर विल बी 7,000. What is her ventricle ejection fraction if stroke volume is 100 and systolic volume is 150? ठीक है, इसमें क्या पूछा हुआ है, ejection fraction. So ejection fraction is equal to a stroke volume by and systolic volume. So this will be 100 by 150 multiplied by 100. So it will be almost 66.7. The answer will be 66%. तो ये जो फार्मूलाज हैं ये थोड़ा इसको मेमोराइज कर लें कि कार्डियक आउटपुट जो है वो स्ट्रोक वॉल्यूम इनटू हार्ट रेट है, जबकि इजेक्शन फ्रैक्शन जो है वो स्ट्रोक वॉल्यूम इनटू एंड सिस्टोलिक वॉल्यूम. ECG findings in pulmonary embolism, sinus tachycardia, right bundle branch block, and S1Q3T3 pattern. This is very important. S1Q3T3 pattern. A 76-year-old woman, on general inspection, the patient had facial plethora, proximal muscle wasting, bruising, dorsocervical fat pad was visible, central obesity, and permanent abdominal stria. Which test is used to distinguish between pituitary, ठीक है, pituitary and ectopic ACTH production? इन दो को डिफ्रेंशिएट करने के लिए कौन सा टेस्ट हम करेंगे? हाई डोज डेक्सामेथासोन सप्रेशन टेस्ट. ठीक है, पिट्यूटरी और एक्टोपिक ACTH प्रोडक्शन को डिफ्रेंशिएट करने के लिए. A 19-year-old male girl presented in emergency with complaints of sudden voice loss, blindness, and sudden inability to walk after watching a fight of brother in a street. They had normal neurological findings. She is likely suffered from sudden voice loss, blindness, and sudden inability to walk. This is conversion disorder. Test to confirm the diagnosis of Cushing syndrome. ठीक है, कुशिंग सिंड्रोम के लिए टेस्ट करना है तो उसमें कौन सा है, यहाँ तो 24 आवर यूरिनरी फ्री कॉर्टिसोल करेंगे या फिर लो डोज डेक्सामेथासोन सप्रेशन टेस्ट. A 21-year-old girl is presented in OPD with complaints of recurrent bouts of binge eating and self-induced vomiting in fear of being fatty. She was diagnosed a case of anorexia nervosa. What sign will you expect in her? That is Russell sign. Which one drug is drug of choice for bipolar disorder? That is lithium. A 13-year of age girl is diagnosed with Cushing syndrome. She has muscle atrophy and truncal obesity. Which of the hormone is the cause of the condition? So this is ACTH, excess ACTH secretion. In the emergency room, a 59-year-old patient with chest pain and shortness of breath. She had just had appendectomy 8 days ago. Chest examination reveals dullness to percussion on the right side, decreased tactile fremitus, and asymmetrical chest expansion on the right side. Which one of the following is most likely? तो फिर क्या होगा इसमें? Pleural fusion. Philadelphia chromosome is characteristically positive in one of the following. CML. Radiofemoral delay present in one of the following delay is present in one of the following. That is coarctation of aorta. Dietary deficiency of thiamine produces which of the following clinical syndromes? थायामीन की वजह से क्या होता है? लॉस ऑफ प्रोप्रियोसेप्शन, नो. पेरिफेरल न्यूरोपैथी, यस. पेरिफेरल न्यूरोपैथी, ठीक है, डायरेक्ट जो इफेक्ट है इसका. A 50-year-old chronic alcoholic has bruising, inflamed and bleeding gums and painful joint. The platelet count and prothrombin are normal. ठीक है, ये नॉर्मल है. तो फिर कौन सा विटामिन की डेफिशिएंसी होगी? ठीक है, अगर तो नॉर्मल ना होते तो हम विटामिन के कहते हैं, लेकिन इसमें क्या ब्लीडिंग गम्स है, अल्कोहलिक भी है, ठीक है, तो इसमें है वाइट और नॉर्मल भी है, तो दैट इज vitamin C. A 23-year-old individual who believes in mega vitamin therapy develops severe headaches. Ophthalmologic examination discloses papilledema. The cause for this problem is, ठीक है, मेगा विटामिन यानी सप्लीमेंट्स विटामिन के ले रहे हैं और साथ तो उसमें क्या हेडेक और पेपिलेडीमा. सो दिस इज विटामिन ए टॉक्सिकेशन. All of the following drugs may be associated with hepatotoxicity, which is most likely to produce cholestatic jaundice picture. ठीक है, इनमें से सब जो है वो क्या है, लिवर इंजरी तो कराते हैं, हिपेटोटॉक्सिक है, तो cholestatic jaundice कौन करवाता है? दैट इज हेलोप्यूरिनोल.